morning everybody. Today we're going to be treating Paddington. He had last year he tore his cruciate ligament on his knee, and if you look here you can see there's a scar here where they had to take his muscle on the side here to form a little ligament that supports his knee so that his knee doesn't give way under him, because he's such a big dog. At that stage he was weighing 50 kilograms. He was a big fat dog and he was throwing a donut on the ground, and that's why he tore his cruciate ligament. And he couldn't walk on the knee, and we had to make a big decision that took us about 2 weeks to make, whether we put the dog down or whether we operate on him, because operation was going to be very expensive. And then luckily we found another vet that could do it for us for a quarter of the price, and we decided to do his ligament because he was still a healthy young dog, well, youngish dog, not old enough to be put down. So Paddington is now 9, next year May he will be 10. And he's got a little bit of arthritis in the knee and a little bit of a hip pain and that. So we're going to treat him today. And what we are going to do is we're going to show you how we put needles in, and then we're going to do shortwave on his leg. Now he's a very good dog. And you can also see that the needling is not so bad. So you don't have to be scared of the needles. And we are going to do his quads over here, because this will help him. There we go. Good dog, last one. Now put them in his muscle. So don't do this at home unless you're qualified. There, got it. Last one. Now you leave it. Now Paddington has had 3 years of training to help him with, to train him. I did 3 years of training where we did dog school, and we made him do agility, and we did fetching and obedience, and we started doing attack work with him, and we were starting to do tracking with him when he was diagnosed with an exercise-induced myopathy, which means he's got a very rare genetic disease that actually causes a problem with his muscles. And we were advised not to train him anymore because any form of exercise in hot weather, causes him to have like epileptic fits, and then he has like these attacks on him and that, and he doesn't feel very well afterwards. So if we did continue with the training in hot weather, he could collapse and die. So I decided to stop training, but he is well trained. He's my therapy dog now. He lies in his dog bed here when I'm working with the patients. And he's a very friendly dog. He is a Labrador, pure breed chocolate. And they call them trial dogs, so they're good for tracking and they're good for doing attack work. And they're just very, very nice dogs with kids. So Paddington is my therapy dog. Also known as Beast. He'll lie still. He'll lie still until it's time to take the needles out, and then I'll put the shortwave on, which is what you saw me put on Lulu and the tortoise the other day. So, as a good